All right, so I believe this is something that I have showed to you before. So I posted this on Canvas. It's a new module called Medical Scenarios. And this document, I believe, is something that I've showed you before. It looks like this. Does this look familiar? Have we seen this? Have I referenced this at all? Some of you yes, some of you no. So again, maybe you were gone during this part. Doesn't really matter. The point is this is a sheet that we use in the college. If you want to be an EMT, you have to pass a class, and part of passing the class is taking a final, like a written final. It's like 200 questions, and then you have to take like a skills test. And so in the skills test, we test our students on 6 different skills, like an EMT should know. And 2 of the really common failed skills are medical assessment and trauma assessment. And so when I started as a college teacher, I wasn't a high school teacher first. I taught at Oxnard College, and a lot of students would fail. And so I had this thought of like, it's too bad we can't teach these people when they were younger. Like, if they could start learning this younger, they'd do better. Because an EMT class is really short. It's like 6 months. It's a lot of shit to learn in 6 months. And so it's challenging. So part of the cool thing about you guys is like, you have me for 2 years, so we can like really spread out complex topics. And so this has been a goal of mine for basically since I got hired here. I'd like to find a way to get us at least decent at medical assessments. So like I've taught you guys concepts, you understand, like you could probably explain, you know, in a decent amount of detail how the heart works. You understand like what asthma is. You know, you guys are smart. You learned a lot of things, but you haven't necessarily learned like how do I take what I know and now go help someone? Like how do I assess an emergency? How do I be the person who does it? Right now you guys are prepared to like maybe recognize some things, but how do we get to that next step where it's like, no, you can help someone. You could do the whole assessment, you could take care of them. So this is what we use in the college. This sheet is available on Canvas. I'm going to zoom in when I start specifically talking about it, but if you can't see it from where you're sitting, pull it up on your phone or on your Chromebook and you can follow along. As far as notes during this, if note-taking is your style of learning, fair enough. For me, I would just kind of be like watching, listening. And I'm going to ask you guys for like feedback as well. The idea is I want to go through this sheet a little bit and explain what it is and how we use it. The goal is that you guys can practice, you know, after today, we as a class can practice doing scenarios. That's what would be nice. First couple scenarios, I'll need to run you through, but maybe once you guys get comfortable with this, I could just show up one day and I could say, hey, we're going to do scenarios today. Partner up, get with someone, let's run a couple scenarios. And then you guys could like run each other through a fake medical scenario. So this sheet is an important sheet in that. I'm also going to show you guys, and I'm going to bounce back and forth between the two, a video. And this video is a video of an EMT student taking this test. So like this is a student in an EMT program taking this test. And you can kind of see what an assessment looks like. So I'm going to bounce back and forth between the two, kind of where it feels right. But the first thing I want to say is just that like this is the sheet we use to grade people. When you have to take the final exam, and there's already probably some of you that are like, I have no interest in being an EMT, why does this matter to me? If you want to be a nurse, if you want to be a doctor, if you want to work in healthcare, these are concepts that will carry over. Exactly the same format? No, not necessarily. But these are concepts that will carry into other avenues of medicine. We'll teach you how to recognize patterns and how to talk to people and what's going on. But this sheet is literally the sheet we use at Oxnard College, Ventura College, Moore Park College for the EMT program. And if you look, there's a bunch of different like things. This is in order, more or less, of how we are supposed to assess a patient. First we do this, then this, then this, then this, and we kind of go down. It's sort of like, does anyone like to cook or bake? If you've ever followed a recipe in your life, this is a bit like a recipe for proper assessment, like how to actually help someone. It's a grade, or we grade you, so there's like points possible, and when we're actually doing this, we would give you points. So like if you do something, you get a point for doing it. If you don't do it, you get no points for doing it. And at the very end, the idea is that there's 40 possible points. I'm not going to score you. So if any of you are like, we're gonna get graded, Maybe in the future, not right now, definitely not right now. The point is though, at some point there's a grade, there's 40 possible, and the goal of a student is to get 33. You have to get an 80%. So 80% of 40 is 33. And so if a student of mine at the college takes this and they score a 32, thank you so much for your effort, I appreciate you, unfortunately you failed. $1,000 it cost to go to EMT school, gone. 6 months it took to take the class, gone. You can try again next semester if you'd like. Just a single point. So the goal is to be good enough at this to like pass. I think I could get you to a point where you're good enough to like ace this. It's not that hard. The tough part about this in an EMT program is you have to learn it in like 2 weeks. And that's tricky. I'm trying to at least introduce it to you guys so that if in the future you needed to, you'd feel a little bit more comfortable with it. So just starting by explaining that, I'm going to show the video, you kind of watch what's happening, and then I'm going to pause and be like, look where we are. So, again, this is a complicated skill, and it's hard to teach to someone who's paying attention. Like, this is a challenging thing to teach. It's a challenging thing to learn. It is impossible to teach someone who is not paying attention. Like, if you miss it kind of thing. And I don't mean this to like be hard on anyone. If you're tired and that's just the way it is today, fair enough. But it's a hard thing to teach, and it's a hard thing to learn. So it's going to require a little bit of effort on both of our parts. I think it is exciting once we actually get it.
Welcome to EMTprep.com. This is the Patient Assessment Management Medical Skill.
Welcome to the Medical Patient Assessment and Management Practical Assessment. Here we will evaluate your ability to assess a patient, interview them, and verbalize the treatment of all conditions you find. As you move through the skill evaluation, I want you to voice everything you are assessing. During the assessment, you will have 2 EMT partners to assist you. I may have to clarify treatments with you during the assessment as they arise. You have 15 minutes to complete this skill. You may take this time to review the equipment before you. You arrive on scene to a 24-year-old female who's complaining of difficulty breathing. Your scene is safe, and you may begin the assessment at the patient's side.
Okay.
Okay, so first things first. When we do this in school, in all types of medical school, we can't just make patients. We can't snap our fingers and have a real person who's sick in front of us. So a lot of medical schooling, nursing, EMT, doctor, whatever it might be, a lot of medicine schooling is simulation. It's practicing, it's imagination. So there's a certain level of imagining that's happening. We have an actual student who is assessing a fake patient who has the guy who was talking to him in the beginning who is his proctor. Think the person who's like giving the test. He's the person who like has the scenario and is gonna provide information. Now this is gonna seem weird at first, but part of the way through I think you're gonna understand kind of how this works. There's a little bit of a balancing act. The student, the one who's doing it, is going to actually do some assessment on this woman, but because she's just a person and not a real medical patient, the instructor is going to fill in some gaps, and you'll kind of see what I'm talking about. But we've been dispatched. Did anyone hear what it is? What's the scenario for this? What's wrong with the person? Did anyone catch it? Difficulty breathing. Who's our patient? How old? What sex? I think it said 24-year-old female, difficulty breathing. So that's what we're responding to. And you guys have learned like reasons that someone might have difficulty breathing. In fact, some of you might already have an idea. I'm just curious. We don't know. So you might be right, you might be wrong. What's a reason that just right now you might think, oh, maybe it's this. Like, why might someone be having difficulty breathing? Is there anything that jumps out? Asthma? Okay, sure. Yeah, maybe it's asthma. That's possible. Anything else that jumps out right away? Allergic reaction? Those are 2 good things to walk in there thinking. Like you get a call for someone who's having difficulty breathing, you're like 24, maybe it's asthma, maybe it's allergic reaction. Cool, yeah, those are thoughts that I would have. Now, as you get there and you're like dealing with the person, what do you actually do? Listen to what he talks about. They're also gonna kind of broadcast some stuff on the screen, but these are steps that are appropriate to take.
Scene is safe, and you may begin the assessment at the patient's side.
Okay. BSI, is my scene safe?
Your scene is safe.
All right.
BSI means body substance isolation, which basically means gloves. The first step always in any scenario is to protect yourself, put on a pair of gloves. So when we do this, when we go into the other room, when you guys practice with each other, sometimes you will say it, you'll be like, okay, I'm gonna put on my gloves. And sometimes you will literally do it, and you will put on gloves. I have like 5,000 pairs of gloves, so we can use as many gloves as we like. But that's always the first step. Why? Because we don't wanna get whatever they have on us. So gloves are always the first step. Then and if you wanna write this down, you can, but I'll just point out to you, it's literally written down. Like, that's the first one on the sheet. The first thing the sheet says is takes or verbalizes appropriate PPE precautions. So like, you could write down what I'm saying in terms of this is first, but you sort of don't have to because it's already written. But do what you feel like works for you. So he puts on his PPE, he calls it BSI, same thing. And he asks, is the scene safe? And they say, yes, the scene is safe. So.
Okay. BSI, is my scene safe?
Your scene is safe.
All right, so based on my dispatch information, my patient's nature of illness is respiratory distress or difficulty breathing. Is this my only patient?
This is your only patient.
Okay. Right off the bat, I'm gonna request an ALS ambulance.
ALS ambulance is en route.
All right. Based on the nature of illness and my patient's presentation, I don't think C-spine is something that I need to consider. So general impression is that?
So it's kind of, as I bounce back and forth, we're gonna start to build a picture. So if you're confused, just wait, I'm gonna like bridge the gap. But he was given a patient. We have a 24-year-old female complaining of difficulty breathing. The first thing he did, and the reason he did it first is because it's the first thing on this sheet. He's very familiar with this sheet, it's why he's good at it. So very first thing, PPE, done. Put on his gloves, set it. Asked if the scene is safe. Yes, the scene is safe. If for some reason the proctor said no, then that's basically the end of the scenario. You go, well, okay, I'm gonna wait until it's safe. And then that would be the whole scenario. But the scene is safe, so we can enter because it's safe for us to do so. Then he thought to himself, okay, what is my mechanism of injury or nature of illness? We've learned these terms. Hopefully everything that you hear today is not a new term, it's just reorganized, like it's things we've heard. Now I will refresh your memory. Mechanism of injury or nature of illness basically describes what happened. So, or what is happening. If someone got hit by a car, that's a mechanism of injury. If someone fell from a roof, falling is a mechanism of injury. But we have a medical patient, so we use the term nature of illness. This person's nature of illness is difficulty breathing. How do you know that? It's what they call, it's what 911 told us. It's literally what was given to us by dispatch. You know, we're responding to a difficulty breathing, so it's okay. Nature of illness, difficulty breathing. And that's where you guys correctly thought to yourselves, maybe it's asthma, maybe it's allergies, maybe it's something else. That's why we consider it, so we can start to imagine what might be going on and get our wheels turning. Then he said, and I'll play it again after talking to you about this, then he said, I'm gonna call for an ALS ambulance, which means a fancy ambulance with a paramedic. Why did he do this? Because difficulty breathing is a big deal call. When we did the chapter, I told you there are two big deal medical calls. And if you don't remember, cardiac, so chest pain, and difficulty breathing. Those are the two big deal medical calls. Can someone tell me why? Why are those two a big deal? What is it about chest pain and difficulty breathing that say like, danger? And I'm not even really looking for such a detailed answer. It's basically, those two things are very likely to lead to death. It is two emergencies that oftentimes are headed towards dying. If you stop breathing, you're gonna die. If your heart stops beating, you're gonna die. So those two emergencies have a high chance of death. And for that reason, we ask for a paramedic, we ask for help. Now, some of these bullet points are more important than others, and we'll talk about that later, but right now I'm just trying to explain all of them so you guys kind of get it. But so he said to himself, he said, difficulty breathing is a big deal call, let's make sure we call an ambulance. Why did he do that? Because it's a point right here. Now, he also mentioned, I'm gonna consider whether or not this person's neck needs to be stabilized. If I need to immobilize her spine. What type of patient do you think would want their spine immobilized? Like, what's happening? Yeah, trauma, essentially trauma. If someone has fallen, been hit by a car, got beat up, we're worried about the neck. But a woman who is just sitting in a chair, complaining of difficulty breathing, is there any reason to suspect her neck might be injured? Not immediately. There's a scenario where maybe we learn later, like, oh, okay, you know, she did have trauma. But right now, it's fair to say that no, we don't see any reason to immobilize her neck. It's not a thing that's comfortable to have done to you. We only do it to people who need it, and it doesn't seem like she needs it. So he does that. He says, I don't think that she needs any sort of spinal protection. He's correct. So what he did is he kind of just went down this sheet. He sort of went down the sheet. He started at the top, and then he did his little scene size up. So if you guys have this open on your end, and you don't have to, but if you do, and you follow along, he's basically reading line for line for line, asking questions. And this is how we would assess. So I want you to follow again as we continue.
I have a 24-year-old female, is something that I need to consider. So general impression is I have a 24-year-old female seated in the tripod position, having difficulty breathing. As I walked in the door, she's alert and conscious, so I'm going to give her an A for level of consciousness. So, ma'am, my name's Dan. I'm with the ambulance. What seems to be the problem today?
My chest just feels really tight.
Okay, and it seems like you're having some difficulty breathing, is that right?
Yeah.
Okay.
So again, nothing new, hopefully, in terms of like what we've covered. So like AVPU, I hope at this point you feel familiar with AVP and U. So he walked in, she's sitting on the chair, her eyes are open, she's looking around. That makes her alert. And he said that. So he's communicating that. He's imagining with us. Like obviously she's alert, but he's a student being tested. So he has to explain that he recognizes that. He has to say, I see that my patient is alert. And then me as the tester goes, you get a point, because that is correct, she is alert. And then he goes down and he thinks, okay, what should I do next? And he verbalizes her chief complaint. He says, hey, my name's Dan, I'm a whatever he said. What seems to be going on today? She says, I'm having a hard time breathing, my chest is tight. We now have what's bothering her. That's called a chief complaint. Chest tightness, difficulty breathing, that's what she's complaining of. And that's where we're gonna look into. So he got her chief complaint. I'd go down, I'd give him a point.
So her chief complaint is, again, difficulty breathing. So the first thing I'm going to do is move through my ABCs. A, airway.
So we know the ABCs, hopefully. And it's, you know, something that I talk about a lot, but I don't know how many of you like let it really sink in. So he determined her level of responsiveness. She was A. He asked her what seems to be the problem. She said, I can't breathe. So her chief complaint is difficulty breathing. Now, he's going to check and see whether or not there's anything that is going to kill her. He is doing the ABCs because that looks for life threats. That's looking for life threats. You're gonna hear him ask these questions. He's gonna ask, is her airway open? Can anyone tell me there is something that already told us her airway is open? What is that? She is speaking. Because she can speak, it is safe to assume her airway is open. This guy he was not a student of mine, or else he would know that. That's a thing that I teach. You're gonna hear him ask, like, is her airway open? Yes, it is open. You guys all are aware of that because she's talking. So the fact that she can talk tells us her airway's open. Then he's gonna ask about breathing. You know, how is her breathing? I'm gonna measure her breathing. And when we do this, a lot of times we're gonna ask you to demonstrate, like on the person in front of you, how to do it. So if you guys ran each other through a scenario and you guys were partnered up, and it was like, hey, what's the patient's blood pressure? You should actually take the person's blood pressure, build that skill up, build the routine. Now, she's not a real patient, so her vitals are gonna be normal. So they'll kind of imagine, but just watch.
Listen to her. Can I hear air moving through just fine? Do I hear stridor or anything like that?
So airway.
She is having difficulty breathing.
Okay.
She is moving good air.
Okay, so she's moving air well enough. So breathing, I would assess her respiratory rate either with a stethoscope or by standing there watching and counting. What is her respiratory
She's
rate?
breathing at 24 times per minute.
Okay, so
So again, this is a normal person. So a lot of times you'll ask a question of the person who's like proctoring you, and we'll provide information about the call. So like, what is my patient's respiratory rate? And he just says it's 24. Like on a real person, obviously you'd have to count, right? And in this situation, it's sort of given or imagined. Now, what does that mean? This is where we're going to start asking. I'm going to start asking for feedback. What if you hear that a patient's respiratory rate is 24? Does that mean anything to anyone? What does that mean? What do you feel? I'm not asking like, you know, to diagnose what's going on, but does that seem fast? Does that seem slow? Where are we? Seems slow? I hear someone else saying seems fast. So we want to know what normal is, and I'll just jot it up because it's that important. That's an ugly looking 12, but the normal breathing rate for an adult is 12 to 20. I just know that. Hopefully soon you will just know that. So 24 is a little fast. It's not terribly fast, but it is a little fast. Okay, so yeah, she's breathing a little fast. Interesting.
With the breathing, I also want to.
Yeah, 24 times per minute.
Okay, so along with the breathing, I also want to listen to lung sounds. So can you take a couple of deep breaths for me? All right. Last deep breath. Okay, what are my lung sounds?
You have wheezes in all fields.
All right.
Okay, so he listens to her lungs, and because she's a normal person, what he actually hears is nothing. But when he asks the proctor, what do I hear? He gives the scenario answer, which is wheezing. He's hearing wheezing. Does anyone have an alarm bell going off in their head? Please don't just outright say it, because I want to give people a chance. But there is now something that pops into my head as a possibility. I hear that, and I think, okay, could be this. Yes? Anyone else? Any thoughts about what could be going on? When you hear wheezing, do you think of a condition? And it's okay to be wrong. Like during this whole period, this whole like kind of section, I'd like you to be really comfortable with being wrong. If you have ideas, just shout them out, because a lot of times you guys might be right. If you're wrong, I'll steer you in the right direction. Thought? So, totally possible. Totally possible. It could be bronchitis. That's a less common answer, but it is possible. Bronchitis does cause wheezing. Iona said asthma. Asthma would be my leading suspicion. It would make sense to me. A 24-year-old, that's pretty young, randomly complaining of difficulty breathing, and I hear wheezing. Bronchitis is totally possible too, and I'll try and keep that in mind. But asthma, maybe, and that's how this would actually go. It's like you listen to your patient's lungs and you hear wheezing and you go, maybe she has asthma.
Alright, based on that, I'm going to go ahead and put my patient on high flow oxygen right now. I'm going to use a non-rebreather and go at 15 liters per minute.
You can verbalize putting the oxygen on the patient.
Okay.
I don't really teach oxygen therapy because I don't have the equipment, and I just think it's not super relevant right now. In the next step, you will learn this, you'll play with oxygen, it's pretty easy. Right now we kind of just like imagine oxygen as this thing we would do. Maybe I can find like an old mask in an empty tank and we can practice doing it, but without the actual oxygen, it sort of feels underwhelming. So I don't spend a ton of time talking about it. It's not really the important part of this, but she's having a hard time breathing. Hopefully it makes sense that oxygen would be nice. It would be helpful.
So after breathing, we're going to move on to circulation. First, I'll check her pulse. What is my pulse rate?
Pulse is present, and it's at 96 beats per minute.
Okay.
Okay, so some of you, when you heard wheezing and you thought asthma, maybe Iona, as soon as you heard that, you thought we should give her an inhaler. If she has an inhaler, we should give her an inhaler. Maybe you had that thought and you like jumped ahead. That's a thing that new people do a lot of times, is they hear that thing and then they jump ahead. ABCs are there for a reason. We need to make sure her airway's open, her breathing's okay enough for her to keep living, and that she is not bleeding out on the floor. So he's gonna finish A, B, and C. So before going down and thinking like, okay, well, do you have an inhaler? He pauses and he says, actually, I'm gonna check her pulse. Like he's probably thinking in his head, maybe this is an asthma patient. But before he can go down and deal with that, he has to continue with airway, breathing, and circulation. So he assessed the airway, got a point. He checked her breathing rate or her ventilation, he got a point. He said, I want to give her oxygen because she's not breathing well, he got a point. Now he's moving over and he's saying, I'm gonna check her circulation. And he said, what's her pulse? What did he say? Did you guys hear a number? What was the pulse? 96. How do you feel about that number? Where does that number fall in the range? It is on the high end of normal. So I hear 96 and I go, not bad. It's on the high end of normal. It's not a huge deal. It's not something I immediately need to worry about. If he had said something like, 170, I'm sorry, the range is still the range. I don't want to confuse you. If he had said something like 170, I'd be like, what the hell? That's weird. That's crazy. This is what's happened. But 96 isn't a big deal. Like, she's having a hard time breathing. It makes sense that her heart would beat a little bit faster to try and help. So I hear that, and I'm like, okay, fair enough.
Do I note any major bleeding?
No major bleeding.
Okay, and then moving on to skin. Skin color looks pale. Do I note any cyanosis anywhere?
No cyanosis.
Okay, and as I feel it, does she feel warm? Does she feel cold?
Normal temperature.
Okay, and do I notice, is her skin wet? Is she sweating, anything like that?
No.
Okay.
So he's a real student, and he's a little awkward. I don't know if you guys noticed this, but he's thinking in real time. You're watching an actual student try and do this. And he's sort of shaky, and that's okay. Like, he doesn't totally know what he wants to do. He doesn't totally know how to say it. When you guys practice this, you're gonna suck at it for a while, and that's okay. A lot of you are gonna be horrible at it, but we're gonna get better. We're gonna practice. And so even still, like, he's making some mistakes. He's a little shaky. That's totally fine. This is a hard thing to do. This is a hard thing to do. And he's sticking with it. He's like, not exactly sure how he wants to say it, but he sticks with it and he gets it. So maybe you're hearing some things that you've learned, like color, temperature, condition. Maybe you were like, well, why last year did you have me check everyone's temperature? Why did you have me write down whether or not they were sweaty? No one was ever sweaty. Like, why did you have me do that? It's for this, so that now you understand. We check 3 things when we check skin signs: color, temperature, condition. So I'm trying to drill that into your head, because when it's an actual emergency, you want those things to pop into your head. So he said she's pale. He said she's warm, and he said that she's dry. So pale's a little weird. Maybe she's going to the beginning stages of shock. But if she was pale, cool, and sweaty, that's big deal shock. That's this patient's in really bad shape. So her respiratory rate's pretty good. 24 is fast, but it's not too fast. Her heart rate's 96. Okay, high end of normal. She's a little pale, but we don't see any blue in the lips. There's no cyanosis. She's still warm. Her skin's dry. This tells me this is a person in the early stages of an emergency. She is not yet in truly critical shape. So me as the provider would be like, okay, she's doing good for the moment. The body is dealing with the fact that it has an emergency going on pretty well. So that's what I think when I hear these answers.
So I'm going to go ahead and make this a priority patient.
But difficulty breathing is still a big deal emergency. It can get worse. And so basically what we're saying is this is a real emergency. This is serious. Yes, she's doing okay at the moment, but this is serious.
Try and transport her as quickly as possible. So next I'll move on to my OPQRST. So ma'am, how long ago did...
So again, you guys are hopefully not hearing OPQRST for the first time. We've talked about this. What's the other acronym that you might expect to hear? Sample, yeah. So again, the goal is to get 33 points. The goal is to pass. But also this is teaching you how to assess someone. The reason this sheet exists is because it's a good way of assessing someone. So and I just want to recap. He determined her responsiveness, she was alert. He said her chief complaint was difficulty breathing, got it. He assessed her airway. Because she was talking, it was safe to assume that her airway was open. He checked her breathing. She was breathing in 24 times a minute. She said it was hard to breathe. And she was also wheezing, so he thought, let's give her some oxygen. He did that, good idea. Then he checked her pulse. Her pulse was 96. He checked for major bleeding, no major bleeding. He looked at her skin. Her skin was a little bit pale, but she was still warm, and dry. So great, he's nailed everything so far. His scene size up was great, his primary assessment was great. He hit the big things. Now he's entering what we would call the secondary, or the history taking. There are a bunch of questions he's about to ask, and you hopefully know all of them. If you don't, that's okay right now. But like as we practice this, you're gonna get much more familiar with these questions. So listen, I want you to notice what the questions are, and then listen for the answers. If there's any answers that like make a light bulb go off or anything like that, try and remember, I'll ask you.
Did this start?
About an hour.
My OPQRST. So ma'am, how long ago did this start?
About an hour ago.
Okay. And what were you doing when this started? What provoked this?
I was just watching TV.
Okay, just watching TV. And can you describe the feeling for me?
Yeah, it just feels really tight in my chest.
Okay. And on a scale of 1 to 10, 0 being not difficult to breathe, 10 being I can't breathe at all, where would you rate this?
I'd say about an
About an 8. Okay. And again, how long has this been going on for?
8 for an hour.
Okay. So, and then after I've got my OPQRST done, I'll move on to my sample and try and get a little bit more information. So,
You could do either or. You could go sample, then OPQRST. You could go OPQRST, then sample. It doesn't really matter. Of those answers, so right now as a class, it sounds like we're suspecting maybe asthma. Like that's our thought, maybe. Was there any answers in there that made you think that sounds like asthma? Or were there any answers that said that doesn't sound like asthma? Were there any answers that meant anything to anyone? I can't hear very well, so if you, the time, what about it? Are you saying like an hour is a pretty long time to have an asthma attack? Potentially, yeah. Something I noticed, do you guys remember what a likely trigger for asthma is? I talked about like 2 common triggers. Can anyone remind me, like what usually causes asthma attacks? Dust, weather, wind, chemicals, for sure, that's kind of like one. I call that like irritants or exercise. Yeah, so she, what did she say she was doing? It's kind of weird. It doesn't mean it's not asthma. It's just a little weird. It makes me, as the provider, kind of pause. And I think, you don't hear very often of people having asthma attacks while watching TV. That's somewhat rare. Now, if you have any other thoughts, your thoughts are relevant. They're probably good thoughts. God, let's see what I can accomplish in 2 minutes. 35, I'm gonna start losing you. Okay, so we'll actually pretty much pause here, but I wanna put a bow on what I'm saying, so don't like fully check out yet. So, we've covered the first part of this, and we're gonna talk more, we're gonna talk more about this tomorrow. So, this whole thing makes up an entire patient interaction. We're in the beginning of history taking. When we come back into this tomorrow, we're gonna pick up here at, he was about to start sample. We have an idea that this is an asthmatic patient. We'll see whether or not it's true. Now, is this making sense? Okay, I don't like that I wasn't able to get through the whole thing because it feels like incomplete, but we will get there. And then, so if you have this feeling right now of like, so what? I haven't gotten to finish it. Hopefully tomorrow there will be a conclusion of like, oh, I get it. Difficult skill, if you've been following along, awesome. We're entering the part of class where like, it's gonna get a little challenging. Like you gotta notice that one little thing. You gotta think to yourself like, okay, she said that, she has a fever, and which, Jasmine, you're totally right that it could be bronchitis. And like if you guys remember, what is like a sign that someone's having bronchitis or pneumonia, because either of those could be possible. It might be a fever, it might be a cough, they might be a smoker. Sometimes that's just like little detail. So we're gonna get there. If you're following along, awesome. This is not an easy skill. This is the hardest part of this class, I would say. So we'll make our way through it. Thank you for your attention. I think most of you are off your phone, so thanks. Appreciate it.